Welcome, everybody. Dr. Brian Allman here in your Vibrant Life radio show, and I'm joined by my co-host,
Julian Allman from the TMJ Therapy and Sleep Center.
And we are so pleased to have with us two experts, and I have so many questions to ask you. This is going to be a lot of fun. I have Lisa Mankus and Brent Skansen sitting next to me, and they're from the Sierra Health Mart Pharmacy. And just a side note, without you, we would be in trouble, because a lot of people may or may not know that there's a big I'm a dentist, of course, and there was a huge lidocaine shortage. And I teach a lot of courses in our office, how to do certain injections painlessly, of course.
Of course.
And without your expertise and help, we would have had no lidocaine. So I want to thank you very much in advance and publicly for your work. Now, tell us a little bit about Sierra Health Mart Pharmacy and what makes you so special. There are a lot of pharmacies in Reno and Sparks and out part. What makes you so? I can tell everybody what makes you so special, but you tell us what makes you so special.
Lisa, do you want to start first, or do you want me to go first?
Why don't you go ahead, Brant?
Okay,
and
I'll start.
Interject.
So probably one of the biggest differences in our pharmacy compared to your typical pharmacy that you'd walk into is that we do specialty medications out of our pharmacy where we'll create medications from scratch. Mm-hmm. Basically, we're in a big kitchen in part of our pharmacy where we can make up lidocaine injectable, as you were talking about, Brian, where when there's a shortage, we can come in on that. Or if someone's allergic to a medication, dye, or a filler, if we have access to that raw base chemical, we can actually allow that patient to take the medication without that sensitivity.
And that is so important because, you know, most medications come in set dosage, like 500 milligrams, 120 milligrams.
Correct.
But those are averages. Those are not, that is not set in stone. And so quite often, I have found in our practice of craniofacial pain at the TMJ Therapy and Sleep Center is that you have to really oftentimes tailor medications, or you do a lot of transdermal, a lot of ointments and things that are absorbed through the skin.
Mm-hmm. Yes.
A lot of people's guts can't take that, and I think without that, that's quite a service that you provide.
And then also, too, as a side note, I am the nurse educator within the pharmacy. I'm an RN, have been in our community for over 20 years, which is amazing. Mm-hmm. But the one thing, too, that we've searched, and ironically, I am the only one that we have found nationally working within a compounding pharmacy as far as a nurse.
Really? Now, what does an RN bring to a compound pharmacy?
More the clinical aspect. We have built this triad between myself as far as a clinician, as an RN, with the pharmacists, the compounders, and then also with patients' practitioners. So I'm kind of the middleman when I meet with clients, because I've got that collaborative relationship with the practitioners in our community, but then also within the pharmacy.
I know that pharmacists are going to garner or be the sort of turfed patient problems more and more. I see that in sleep. I deal with a lot with sleep medicine issues, and it looks to me like the pharmacist very soon will be providing the out-of-center sleep testing and things like that. Do you see that trend happening where more and more you'll become almost a physician's assistant?
Almost, and I think that we're seeing the patients actually come in and search out the answers because they don't know where else to go. So being family-owned and locally owned, people will come by and just walk in and inquire about a supplement or just search for help because they're lost in what they're going through.
Well, for you guys, I think as a woman, we tend to chat a lot with each other, and we tell each other, hey, I found this at this place, and I found that at that place. And you guys are one of those conversation pieces where women who are maybe going through some hormonal issues or change of life issues, if we want to put it that way, you talk to your girlfriends and you find out what's going on, where to find the good things, and you guys have come up many times in conversations that I myself have had. So, which is how I found you.
We're grateful for those conversations.
That's how I found you.
Well, and you're very, very, very personally involved.
Very much so.
In women's wellness. And tell us about the Women's Wellness Party with a Purpose. Because as I look through your CV and I look through all of the things that you've accomplished in a very short period of time, it's very, very unique, because I personally rely on pharmacists very heavily. I mean, most dentists use maybe 5 drugs and that's it. Where I'm involved in all kinds of different drugs, or just analyzing where the polypharmacy or the multipharmacy is coming from. Again, I want to thank you for your help over the years. But you're really focusing on this Women's Wellness Party with a Purpose. What is that all about?
Well, For us, it's the way we give back to the women of our community. We started where David, also one of the owners and pharmacists, he and I would go to homes, businesses, more or less wherever they invited us in. And what we do now is we bring the entertainment, so to speak. So let's say Julie was going to have a wine night with the girls. So she provides the wine and the goodies, and we provide the entertainment. So we come in and do this whole educational opportunity, PowerPoint, but it's an open discussion. It's like a round table. It's a girls' night out. So what we do is we educate women in all aspects of perimenopause and menopause, because a lot of women don't realize that the menopausal symptoms or perimenopausal symptoms can start 10 to 15 years before menopause, the big M, is ever truly
Right.
diagnosed. And women don't really know what those symptoms are or what to look for. So what we try and do is educate them and reassure them that they're not going nuts and they're not alone in this little, craziness that we're all living. And it's not until they're out with their girlfriends and somebody has a hot flash and then all of a sudden the conversation opens. Pandora's box explodes with, oh my God, I thought it was just me. And so for me, and again, this is kind of the shock factor that I give to it, because one, I love it and I'm very passionate about it, but my personal platform is I'm changing the world one vagina at a time, because somebody has to.